Hi, hello, and welcome to another episode by Move, where I share with you what it's like to live and work in China. Today, I want to talk to you about why is it so bad that we are politicizing the coronavirus investigations. It's going to be a video full of references and full of videos and evidence that I want to share with you so that we are able to make our own conclusions, because it's a topic that is very difficult for us to figure out exactly what is taking place. So make sure to stay until the end, but I want to start this video with a very short clip. This clip was taken in early March of 2020. It is important to remember that the first case that arrived to the USA was around February 20 or 25th, if I'm not mistaken, in Washington. So let's listen to this particular clip in which a congressman from California is asking at that time, former CDC director, Mr. Robert Redfield, whether people who are dying are being diagnosed as dying from influenza as opposed to dying from COVID-19, and if there could be some people that are categorized as dying from influenza and not from COVID when they really had COVID. So let's watch.
The public health officials, And
if somebody dies from influenza, are we doing postmortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States.
So there you go. He's saying that some people in the United States have diagnosed as having died from influenza when in fact it could have been COVID-19. That's the first thing to understand. Now, the other thing that people think about when we talk about politicization of the origins of the COVID-19 pandemic is what they see internally. There's two sides to this. There's the internal discussions within the United States and the international discussions which actually affect China. So we're going to start first with the internal discussions. The most popular one is this particular discussion that has been taking place between Senator Rand Paul and Dr. Fauci. So let's listen to this, because this video is going to be very important to some of the pointers on the I wouldn't call them conclusions, but some of the things that I want you to understand towards the end of this video. Let's watch Dr. Fauci's exchange with Rand Paul.
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute
Do they fund
of Virology.
Dr. Barrick?
We do not fund.
Do you fund Dr. Barrick's gain-of-function research?
Dr. Barrett does not doing gain-of-function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina, not
You don't think
in
inserting
China.
a bat virus?
All right, we're not going to play the whole video, but I want you to remember a very important word, Dr. Barrick and North Carolina, where apparently he could be conducting research on gain of function of coronaviruses. Now, first, let's understand what is gain of function. I've made another video before when I talked about this. And gain of function basically means that they're going to study viruses that are transmitted from animals to people. And they're trying to understand how that actually takes place for different reasons. One of the reasons is to be able to stop it so that we don't get infected from this kind of viruses. And the other one is, well, maybe to replicate this and create a biological weapon, for example. But we're not going to go so far into that. It is a very dangerous kind of research for this particular reason. So It was actually banned in the United States more than 10 years ago. Now, you heard there Dr. Fauci telling under perjury, right? Under threat of perjury, saying that the USA is not funding gain of function research in Wuhan. That is not taking place. There is no gain of function research taking place in Wuhan. He also says that if it is taking place, it is taking place in North Carolina by Dr. Barrick. So that's a very important thing to remember. And this politicization issue. You have Dr. Fauci, who kind of like agrees with the WHO's first interpretation. He tries to stay as open-minded as possible. The first investigation of the WHO said that they concluded that it was very unlikely that this virus had actually become a lab leak, had actually just escaped from a lab or just failed to be contained in a lab. That's what the WHO concluded. And Dr. Fauci is very open, said like, well, it could be, it could not be, we don't really know. Now, where does this get politicized? Well, Robert Redfield, who used to be the director of the CDC, at the beginning of the COVID-19, he was also quite open. But let us remember who actually started with the idea that COVID was a lab leak. It was actually Trump. Trump was the person who started saying that this was a lab leak. And Dr. Redfield, seen here in the picture, started to be one of the strongest proponents of this theory. Now, this is important to see the discrepancy between one thing that Dr. Redfield says and the other, because if you go and look at this report, for example, from early December in 2019, the US flu season, not only had it arrived early and had it been a lot stronger and harder, and there's tons of records from people saying that they had very bad symptoms of influenza and respiratory illnesses, but this is also known as an unexpected virus, a virus that they didn't really know what it was. So if you put the video that we just saw from Dr. Redfield saying that people could be diagnosed as dying from influenza when in fact they were dying from COVID, and this push to follow Trump's narrative that it was a lab leak, then things don't add up really. Now, the other thing to understand is, remember that Trump, this is the second part of this politicization. Trump had removed funding to the WHO. He had removed support for many things. He was saying that he wanted to remove support from NATO, different organizations, the Pacific Agreement, I forgot the name. Anyway, leadership roles around the world, he was removing America from them, and the WHO was one of them. Now, when this first investigation took place in Wuhan, the WHO team concluded that, well, it was very unlikely that this was a lab leak. What did America say in that case? Well, they were paid. So this opens up something very, very complicated, because if you are thinking that the WHO can be bought, let me put this over here. If we are saying that the WHO's opinions and investigations can be bought, that is the essence of politicization, now at an international level. Why do I say this? Remember that the first thing that Biden did was to, on the first day in office, he renewed funding for the WHO. So if we are saying that the WHO is for sale, right? When the funding was coming from China, America said, oh, the Chinese paid the WHO. Now that the funding has been renewed by America, the WHO is asking China for a second investigation. So are they getting paid? Is the WHO just selling their opinion? And here's the problem with this. I'm not saying, I'm only asking a question, but Think about the damage that this does, the damage that America has done in politicizing this issue. And when I say politicizing, I say murking the waters. Let me explain. If you think that the WHO cannot be bought, that the opinion of the WHO it's an honest opinion, it's a scientific opinion, it's a sincere opinion, and the team that did the investigation in Wuhan were competent doctors and they were not bought off. So if that's your opinion, then why do we need a second investigation? We need to accept the results of the first investigation. If your idea, if your thinking is that the WHO was not bought, they cannot be bought. Now, if you think that the WHO is bought, right? And that the results of the first investigation were because China paid them. Now that Biden is paying them, isn't it possible to think that that's exactly what is happening? That America is paying the WHO to, number one, say that their doctors, that the team that first came to Wuhan are incompetent, to say that the people who conducted that investigation were bought off, were insincere, were dishonest. So the WHO, in asking this second investigation of the Wuhan laboratory, it's really, for lack of a better word, destroying the credibility and the reputation of the team of doctors that came to Wuhan in the first investigation. So if you are incompetent the first time, what makes you think that you're going to be competent the second time? So there's all these issues about, is WHO competent or not competent? If they failed the first investigation, why should we do a second investigation? What guarantee is there that they're going to be competent this time? If they were bought or not bought, why are we accepting a second investigation? If somebody believes that they were bought in China, well, it's possible to believe that they were bought now by Biden, and that's why they're asking for a second investigation. So none of these things help people to make any clear conclusions or any clear decisions. So we need to understand that this is what America does best. Look at the government, look at the media. You have Fox News, for example, on one side saying, the virus, the vaccine is not necessary. The vaccine doesn't work. And then you have CNN or MSNBC saying, yes, we actually need the vaccine. The vaccine is necessary. It's what they do. And you got to go back and think about this Dr. Redfield, right? How he went on to protect Donald Trump at any cost, to the point where, if I may show you this, Dr. Redfield is getting subpoenaed because they think that he lied to Congress when they asked him, hey, did you go along with Trump's idea of downplaying the coronavirus? And he said to Congress, no, there was no communication. But as you saw there, now there is evidence, there's documents showing that there was actually communication between the White House and the CDC, and he lied, basically. So this Redfield person is losing his standing. It's very important to remember that he became a very Trumpian person. And to continue with this problem with misinformation and politicization, we have the current director of the CDC, Ms. Rochelle Walensky, saying that, yes, if you keep an open mind, COVID could possibly come from a lab. But she says that the most common form of transmission is an animal host. So people in America and now all over the world, like in China, we're getting all this different information. One CDC director, the former one, saying, yes, we think it's a lab leak. It's most likely a lab leak. And then the new CDC director saying, no, we got to keep an open mind. So when you get this conflicting information, you are left in a position that is really not a comfortable one. It's one that is very normal in America. Basically, you are left to follow your gut. And that's not what science is about. You are in a position where you cannot, you believe whoever you want to believe, and that is not a good position for science. But we've got to remember one thing. Who put us here? Who put us in this position? Trump, Dr. Redfield. Remember, he said in this particular clip, let's play it again 1 second.
The public health officials, you know.
And if somebody dies from influenza, are we doing postmortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States.
So this person acknowledges that you don't know really where it's coming from. That could have been people who were diagnosed with influenza that were actually dying from COVID. So that's the first thing. Redfield and Trump just murkied the waters, number one. But there's other issues. For example, Fort Detrick, yeah? Initially, in previous videos, I said that there were two breaches of containment, but Fort Detrick was actually required by the CDC to close down because there were seven issues of lack of protocol. Let me show you a couple of pictures right here. And I'm showing you American media. Let me move to the side. I'm showing you American media because I know that a lot of people are going to say, oh, if you show me Chinese media, I don't believe you. The Army Germ Lab shut down by CDC in 2019, several serious protocol violations. So let's see. This is violation number 1. Let me remove this banner 1 second because it's no longer valid. So it says, the CDC reported that an individual partially entered a room multiple times without the required respiratory protection. So that's a very serious one. What's number 2? Failures were recognized through video review of laboratories, reported that the lab did not ensure that employees' training was properly verified. Number 3, violation of observation. The CDC went into more detail on the incident of the worker not wearing gloves while disposing of biohazardous waste. Next one. In this observation, the CDC notes that the United States Medical Research Institute of Infectious Disease had systematically failed to ensure implementation of biosafety and containment procedures commensurate with the risk associated with working with selected agents and toxins. And number 5, moderate, reported that the laboratory failed to safeguard against unauthorized access. So there were 2 more, but I'm not going to show you all of this. Those were what they call low safety precaution, but this is a low safety risk. But this is why it's important to look at Fort Detrick. They were negligent in the way that they were operating over there. This is why a lot of people are talking about Fort Detrick. But another reason why people are talking about Fort Detrick is because Fort Detrick is only 1 hour drive away from the elderly home in Spring Green. So let's watch this video from the news when they tell us about Green Spring.
At least 2 patients have died, dozens more sickened, and tonight parts of that facility are now under quarantine. ABC's Kira Phillips is on the scene.
Tonight, a deadly outbreak in Virginia. 2 deaths and dozens of residents sickened by a respiratory illness here at the Green Spring Retirement Community.
For a respiratory outbreak to occur in July would certainly not be as likely as for it to occur during the winter.
In just the past 11 days, 54 people have become ill, symptoms ranging from a bad cough to pneumonia. No promising leads on how the sudden illness broke out, but in a statement from the retirement facility, It says it has taken all necessary measures to fully implement proven infection prevention and control strategies.
David, health officials are testing patient swabs, hoping to figure out what this virus or bacteria is. Meanwhile, sick residents have been quarantined to their rooms. New residents are not being admitted, and all staff are wearing masks and protective gloves until test results bring about answers.
So basically, again, this is an unknown respiratory illness that killed 54 people. So, and this is 1 hour from Fort Detrick. So it's very easy for somebody to get contagious. But this is not the only reason why we should look into America and America's resistance to actually be transparent and open for Detrick and open an investigation into what was taking place is what makes a lot of people very upset and think that they must be hiding something. If you have nothing to hide, why are you not transparent? But let's go into this new aspect. This is, note, when Trump decided to ban e-cigarettes. Okay, this is again from the Times, so that you watch actually Western media. Now, the Times says that the CDC updated information saying that there were 2,500 people that had been hospitalized for e-cigarette or vaping product associated lung injury. So these are lung injuries. 54 people died as well, caused by vaping. Here is Mr. Asnar, Alex Asnar, the HHS secretary, saying that the United States had never seen an epidemic of substance use arise as quickly as our current epidemic of youth use of e-cigarettes. So here's the thing: they're focusing on the fact that it's just vaping and e-cigarettes, but people vape and use this kind of e-cigarettes all over the world. In England, in Australia, in France, in Canada, in Spain, all over the world, but there were no issues over there. So interesting to see all these different situations with viruses and respiratory illnesses coming out from the United States. You have the breaches of Fort Detrick, the Greenfield elderly home in summer, which is quite important. We also had another important thing to remember, the Wuhan Games that took place in fall. Military members came to Wuhan. They could have brought the virus and spread it, I'm not saying willfully or consciously, but they may have spread the virus in Wuhan, and that's why it ended up in the wet market. But yeah, this is something that we need to connect. There's another very important fact that also relates to the military. It's what is called the blood sample program, or the blood program that actually brought blood samples to Italy. And we have information that in Italy, according to Reuters, there was coronavirus circulating earlier. This is September 2019. I'm showing you Reuters because then it's Western media, but here's the CDC. And if you look at the bottom in the abstract, it says we identified severe acute respiratory syndrome coronavirus 2 RNA. And basically this is from December 2019. So there's many pieces of evidence that connect the army to very early onsets of coronavirus. In Italy, this thing that was unexplained in the early retirement home, the vaping thing that only happened in China, and then the military coming to the Wuhan Games. So with this particular aspect, I want to show you one last piece of information that is going to bring us full circle. Here you can see this is a medical article published in a journal in 2008. If you see in red, it says October 14, 2008. And this was an article in which, as you see in yellow, Ralph S. Barrick, the doctor that was mentioned initially in Dr. Fauci's argument with Senator Rand Paul, was actually writing this report. And if you look in green, it actually mentions the University of North Carolina. And what does that say? It actually says, let me put it back up again, that they were able to synthesize recombinant but SARS-like coronavirus, and they made it infectious in culture cells. Well, culture cells are replicas of human cells, and synthesize means that, well, they manufactured it. They combine different viruses or different parts of a virus, and they were able to get it to pass into humans. In 2008, Dr. Barrick in North Carolina.
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute
Do they fund
of
Dr.
Virology.
Barrick?
We do not fund
Do you fund Dr. Barrick's gain-of-function research?
Dr. Barrett does not doing gain-of-function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina. Not
So there you go. This person who in 2008 was already able to pass coronavirus to cells is still conducting a gain of function, apparently, possibly, according to Fauci, in North Carolina. So there you go, guys. Just all this misinformation that we are being fed, and that allows us to think that we should be looking into the United States, be it Fort Detrick or be it the North Carolina University. What's taking place over there? What is causing all this? Let's go back over here. This early onset of the flu season with an unexpected virus. What is causing all these vaping problems? What is causing this retirement people from this retirement home dying of unknown viruses? It's worth having a look. And again, the biggest issue here is, why do we find ourselves here? Because Trump decided to murky the waters. And Dr. Redfield, who is already being subpoenaed because he lied to Congress, decided to go with him. And now everybody is giving you conflicted information, contrary information, the contradicting information. The former CDC says it's a lab leak. The current CDC says the more likely thing is an animal transmission. Again, guys, I just put this video out there to understand why the politicization of the origins of the COVID-19 is such a bad idea. We may never know, we may never learn the origin of this virus, because there's just all this silt in the water. We can't see what we need to see, and nobody is being transparent. Particularly, the U.S. is not being transparent with all this evidence pointing at something taking place in America. So that's what I wanted to put out today. Thank you so much for watching, guys. And as always, if you like this video, give it a thumbs up. And if you like the content on my channel, then consider subscribing to it. And if you do that, don't forget to hit the bell button to be notified whenever there's a new video out. And well, until I see you again, take it easy and bye for now.